GvHD Hub podcasts, brought to you by Scientific Education Support.
Hello and welcome to the GvHD Hub podcast. Today we'll be hearing from Nada Hamad of St Vincent's Hospital in Sydney, Australia, and Silvy Lachance of Hôpital Maisonneuve-Rosemont in Montreal, Canada.
Hello, and welcome to GvHD Hub. I'm Associate Professor Nada Hamad, and I'm joined by Professor Silvy Lachance. We are here to talk about quality of life and the unmet need that it demonstrates in GvHD. Silvy and I worked on a number of abstracts during ASH this year, looking at quality of life in acute and chronic GvHD. Silvy, I'm going to turn it to you and let me want to hear what you think about the abstracts that we presented this year. What was so interesting about them, do you think?
So hello, Nada. Thank you for the invitation. So I'm Dr. Silvy Lachance. Well, I think first we give patient a voice by focusing on patient-reported outcomes. We let patient express the impact of graft-versus-host disease have on their life, on their day-to-day life. So basically, what we were able to demonstrate is that the severity of graft-versus-host disease have a significant impact on quality of life on several aspects of the day-to-day life. And not surprisingly, also being cortico-resistant or being stuck with corticosteroid treatment for a long period of time also impact quality of life. What is your aspect on that topic, Nada?
It's really interesting because it's not something that we as clinicians didn't know. We see this in the clinic, we see this on the ward on a day-to-day basis. But I think what's important is sometimes capturing that information objectively and documenting it really demonstrates our ability to listen to patients and really validating that experience. And documenting lived experience of patients has become an area of interest of mine because sometimes, patients feel unheard or unseen in some of the things that they're experiencing. And one of the aspects that came out of the abstracts was that feeling of hopelessness, embarrassment, worries about the future. These are things that patients may not articulate to us so readily on a ward round when we're busy on the ward looking after them and asking them questions about their rash or their diarrhea or any of those physical complaints that we ask about because that's what we're trained to do. So capturing that lived experience to me means everything, because I think in medicine sometimes we have a blind spot for how people experience disease, because we're naturally very focused on the biology, the pathology, the treatment options, the research. And I think it was a humbling moment really to see that on paper, those symptoms and those feelings of depression and sadness. It really made me contextualize the information that we talk about in, big papers and clinical trials. What does it actually mean to patients? That was quite powerful, I thought, from a human level.
I totally agree. They have the knowledge to truly express the impact of the symptoms on their day-to-day life. And they do that in a fashion that is that we are able to capture and to express very vividly.
And I think it taught me a lesson as well about how we ask questions. In the clinic, we're trained in medicine to ask questions in a particular interrogative way. We may not necessarily always, ask those specific questions about the feelings of sadness and worry and embarrassment. So, putting them in a tool that captures that information made me rethink about, how I might ask questions to my patients and perhaps explore those more openly and more frequently with patients. I think that, the way we do things routinely doesn't necessarily always suit the purpose, particularly with chronic diseases and diseases like GvHD, where they're quite entangled with the stress of survival, because with bone marrow transplantation, of course, everybody knows that these patients have almost terminal illnesses, that the intention is to, use a very highly complex, high cost, and high risk procedure to save their lives. So we do have a specific focus around survival. And so we may miss those cues around the psychosocial impact of graft versus host disease and even the transplant process itself. So seeing that on paper was a little bit confronting, because I thought, do I ask those questions really on a day-to-day basis? And I probably don't ask that enough. And perhaps we ought to integrate that into our day-to-day a bit better.
I also agree. I think that we are well aware of the impact of graft versus host disease on the quality of life, but also on the day-to-day life of our patient. We know that it has a significant impact on their survival when it's certainly severe. What we were able to capture is a little bit more deep and probably a reflection of the patient on their disease and on the fullness of how they could express the way they live with some of the manifestation, and also what are the impact of those manifestations on their entire family. Because also when we are treating a patient, we're not only treating a patient, we treat also the significant other that are surrounding our patient. And by expressing those symptoms and personal one, they are also to give the scientific community tools to understand and to try to better study not only the mechanism of graft versus host disease, but how we could impact some specific symptoms. And when we are opening the box of quality of life, there is a lot of management that we can say and that we can do to try to improve the living of our patient. So basically, not only it made us aware of the impact of significant graft versus host disease on the survival and on disease-specific aspect of the day-to-day life of our patient, but also on their psychological way to deal with those manifestations, and what is the impact of those manifestations on their capacity to return to work, for example, to take care of their children, to be able to do things that we take for granted, most of us. So I think it also not only it gives patient a voice, but it's an open eye for us. First, to try to better develop modality to prevent graft versus host disease, because the best way to treat graft versus host disease is to prevent it, and also to think about intervention when patient will become a partner in his own health. So to have a real partnership with our patient, trying to address this extremely important manifestation in their life, because most of them, at the point that they fill out the questionnaire, relapse was not an issue. They were, for my part, but looking at graft versus host disease, they were now looking ahead to try to go back to their normal life. And certainly this study was able to demonstrate that there are several obstacles for them to go back to their day-to-day life.
I think it also, you're very right, it also allows us to leverage this information in how we assess the value of interventions. The expense or the cost that might come with interventions. Is it something only about survival? Is it only about response to therapy? Or is it also about influencing quality of life? What do we value in the new interventions that are coming through and the research that we're doing in graft versus host disease treatment? I think, quality of life needs to be front and center, because unlike, treatments that we see for diseases like lymphoma and myeloma, where we have very specific outcome measures that are quite impressive in terms of survival advantages and progression-free survival advantages, graft versus host disease responses are much more subtle and nuanced. You may not necessarily get the objective measures that you would see in other areas in hematology, but if you do see quality of life improvements that are not necessarily correlated with the physical improvements, that is also a win. I think that would be quite impactful and valuable in any intervention that we explore. So I think quality of life data should certainly be quite a big endpoint for us to look at in research in the future. And I really love the concept of using the patient voices to direct our future research and the way we report on the research that we do.
Well, I think that self-reported symptoms is certainly a way to involve patients in their care. It's also a way to realize a real partnership with our patient, and they're a significant one. And I think that it takes into consideration topics that we are very comfortable to focus on, meaning symptoms, manifestation, but it goes much further than that. And as you were mentioning, we are focused on survival, but we don't want our patient to survive. We want our patient not only to survive, but to live and to be able to go back to their normal activities. And by giving them a voice, and by capturing their manifestation and giving them the power to transmit and to express those manifestations, and to capture that in a scientific way, it's certainly for me one of the ways to completely realize what we probably want to do in medicine is to partner with our patient and be considered as a team working on the same issue and trying at the bottom line to improve graft-versus-host disease treatment. And treatment of graft-versus-host disease is not only medication, it's prevention, it's medication, but it's also all the intervention that we're going to make to try to improve those issues that were underlined by patients regarding their quality of life.
I think it's also incredibly validating to see it on paper, you know, what we all know as clinicians internally and we try and account for. But once you see that the data really does demonstrate a very clear signal, you can start to really incorporate that into research or demand that that's part of clinical trials and part of clinical trial reporting or outcome reporting. So I don't really want to see a graft versus host disease clinical trial anymore that doesn't report on quality of life, because we've demonstrated that's really important. I think that's really valuable, and it demonstrates a lot of areas of unmet need. Certainly in GvHD, there's a lot of unmet need, but certainly it has consolidated or validated the approach that we've all known, that it's a multidisciplinary approach to GvHD. You know, it is a body and mind type of disease. It's a chronic disease that requires multiple disciplines to be involved. And certainly the psychological aspects should not be ignored. And sometimes resources can restrict that and limit that. But having that data on paper really does allow me to, advocate for patients to have access to psychology support and social support. I don't think, when you have it on paper like that, people find it very difficult to deny that that is a requirement to management of BMT and GvHD patients. So, that validation for what we know and what we want to do for our patients and advocating for patients is really quite powerful. And I'm really hoping that the manuscripts can really support us all in doing what we want to do for our patients.
I totally agree with you that we cannot envision currently, even in other topics related to stem cell transplant, I think it would be difficult not to consider and study patient-reported symptoms and patient-reported outcomes and those studies, and particularly the one involving new intervention, new medication, because response is not only resolution of the manifestation or of some manifestation, but how do patients tolerate the medication? How do patients tolerate the intervention? And what is the impact of this intervention on their day-to-day life? So I do agree that patient-reported symptoms should be now part of all the investigation. And I think that it certainly underlines the capacity, the reliability, as well as the sensitivity of patient to be able to transfer significant information, and how valuable is those information for the scientific community while trying to develop study and while trying to develop newer intervention.
I completely agree. And I've found this conversation so rewarding because even though we've worked on this together, so we really haven't had a philosophical conversation like this about these abstracts. This has been really lovely and quite enriching, in terms of having a bigger picture view of what we do. Sometimes we got really caught up in trying to get the work done. But really, I think in medicine in general, in this era of COVID, in this area of thinking about the lived experience, gender equity, diversity, and inclusion, we've all started to think a little bit more openly and differently, perhaps, about how we do things. And I think, it's filled me with a great sense of hope around medicine in general, but certainly what we do, because it's very hard, it's emotionally challenging. And this was really one of those projects that was really quite personally enjoyable and valuable to me.
Yes, I do agree. It was quite rewarding. And I think the best reward we can have is that it will have an impact on our patient. So it was extremely pleasant to speak to you from Canada through Australia with a strong French accent from my part. So I enjoy speaking with you about graft-versus-host disease and about patient self-reported outcomes. So take care. Enjoy the meeting.
Thank you.
Thank you for listening to the GvHD Hub podcast. We would also like to thank our supporters Insight and Novartis.
GvHD Hub podcasts, brought to you by Scientific Education Support.